the opportunity to give this talk on behalf of ECDC and colleagues at EATG and AIDS Action Europe. So I'm presenting some of the results from a survey that we did a year and a half ago now. So starting off with this data showing you that end of 2021, we estimated that 2.3 million people were living with HIV in this wider WHO European region. We see that 36% of those people live in the West, those countries highlighted in green, 2% in the center, and 62% in the East. So the burden of HIV, as you know, is in the eastern parts of the region. So in the EU EEA, we estimate that there are roughly 770,000 people living with HIV. So you're all familiar with the UNAIDS targets. Something that we've been trying to do with ECDC is monitor how countries in Europe are progressing towards these targets. And we have, we're very lucky in the HIV field to have such good data as we do compared to many other infectious diseases. But this issue of stigma was identified 2-3 years ago by us, that we always show the great data we have, but we always end with stigma saying countries can't report data on stigma. So this was part of the reason we reached out to community partners to start doing something about this. So we all know that the UNAIDS target is that 10%, less than 10% of people living with HIV and key populations experience stigma and discrimination. And we know that this is probably one of the most important and difficult targets to reach going forward. And we know why this is important, that it affects all other targets. So in order to reach all these prevention, testing, and treatment targets, we need to address this issue of stigma. And that's why it's important to have data around it, so we can do something around the policies that affect these experiences. So as I said, we published this report 2-3 weeks ago together with EATG and AIDS Action Europe. And one of the first things we wanted to identify was issues around quality of life. So we asked participants, how satisfied are you with your life? You see here that 53% responded that they had relatively high levels of life satisfaction scores, which are standardized instruments for how to measure this. 31% in the middle and 16% identified lower scores. And this life satisfaction score is an instrument that's been done in the general population as well. The average life satisfaction score in this survey was 6.2, and the 6.7 is in the general population surveys that are done across Europe. So why this is important is that we're going to show you some data later on how this affects experiences of stigma. So looking at self-stigma of respondents, here we see that roughly 6 out of 10 people still find it very difficult to tell people that are living with HIV. And a third of respondents have very poor self-esteem because of their HIV status, or they still feel ashamed of their HIV status. So this is the first time we're getting these percentages, and over time now we hope to see some improvements in these areas. Issues around quality of life, very important. We know this issue of so this data shows you experience of stigma by markers of depression. So this is self-reported depression in the last 2 weeks. Those are highlighted in the blue bars, and in green bars, those that did not report they were feeling depressed. And at the bottom, you see the different experiences of stigma. And basically what this data shows you is that those who reported that they were depressed in the past 2 weeks have roughly twice as likely to experience these forms of stigma. So the association between depression and experiences of stigma is marked in the survey that we did. This is a busy slide. It shows you the proportion of respondents who have ever told people in their life about their HIV status. And if we zoom in here at the bottom, very slow. Basically, 30%, 3 out of 10 had not told a single family member that they were living with HIV. 1 in 5 had not told a single friend or current sexual partners that they were living HIV. So these are quite high percentages and says something about the environment. This shows you, and I'm going to show you how experiences of stigma in different categories, starting with friends, family, and sexual partners. And in the boxes here at the end, you see 24%, 1 in 4 people have been ever experienced rejection by family, by friends. And in the red bars, which I want to zoom in on, is in the past 12 months, in the last year. Okay, so look at the ever experienced and in the last year, which are the important markers now. So 24%, 1 in 4 had ever been rejected by friends, 17 been threatened, verbally abused, and physically harmed by a sexual partner, 64% in the past year. That's when it comes to family and friends. And when we look at the experience of stigma in the healthcare setting, it's much higher frequency reported stigma in the healthcare setting. So 56% have ever been worried about being treated differently by healthcare staff. That's 1 in 4, 26% in the last year. So we always see down the different categories, we see here the avoided healthcare services. 1 in 3 had ever avoided healthcare services, 16% in the last year. So it's a very high proportion that are avoiding healthcare services out of fear of being treated differently. Now, if you look at these two, again, a busy slide, looking at these experiences by the life satisfaction score, as I said before, let's zoom in the red boxes here. So basically what this tells you is that those people who responded that they had low life satisfaction score were much more likely to have experienced stigma compared to those who reported that their life satisfaction score was high. So here or here. So 2 to 3 times higher experience of stigma if you had identified your life satisfaction score. So this association, again, between how satisfied you are with the life and the experiences of stigma among both family and friends and in the healthcare setting. This shows you the experience of stigma in the dental care. We know this is a major issue. 1 in 3 had ever been afraid to go to dental services because somebody may learn of their HIV status, 15% in the last year. Again, 1 in 4 had avoided dental services altogether, 12% in the last year. So still very high percentages. And in terms of experiences in stigma in the society, apart from family and friends, we see here that 1 in 5 had been verbally harassed, 15% had either been treated differently, verbally abused, been scared to go to public places, or been treated unfairly at work. So again, it's quite high percentages. And in terms of experience of stigma within the justice system, again, we see here that 28% had been concerned that they may be criminalized because of their HIV status, 12% in the last 12 months. So a very high proportion of respondents. So to conclude, this is the first time that we have European data on the experience of stigma across the European setting. 1 in 5 people living with HIV have not told a single friend, and 1 in 3 have not told a single family member that they were living with HIV. There's high levels of experienced stigma from family and friends, and even higher levels of experienced stigma experienced in the healthcare setting. And stigma within the healthcare setting demonstrates that there is still a lot of work to be done to make people living with HIV feel safe in these settings. As I said, we hope to repeat this now. We have a baseline now. We hope to repeat this 2-3 times leading up to 2030 so we can see there's improvement over time. But overall, the conclusion is that HIV-related stigma is highly prevalent and more efforts are needed to address stigma in order to improve the quality of life of people living with HIV. So, and just to say that we have an ongoing survey now to measure stigma in the healthcare setting. So together with EATG, we are running a survey now that's going to be extended until end of November. This survey is translated into 38 languages, so we really need to promote this surveys to try and measure the level of stigma among healthcare staff. So please help promote that survey. Lots of colleagues that we need to acknowledge, several people in this room, and especially European AIDS Treatment Group and AIDS Action Europe. So, and of course, all the people who took part in the survey. So thank you very much for your attention.